Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What is new with skin cancer screening? Find out more right now. My guest this evening is Dr. Ronald Shore, a noted dermatologist practicing here in Montgomery County. Ron, welcome to Housecall.
Thank you very much. It's a pleasure to do this.
So briefly, Ron, tell our viewers about your professional background and your private practice.
I'm originally from Canada. I came to the United States. I'm now a citizen of the United States many years ago to complete my postgraduate education. I was accepted into Johns Hopkins, where I did my internship. And then I went on to do my dermatology residency at the University of Pennsylvania and got an extraordinary education. I've been in both in academics, which I was on early on, and I've been in private practice for quite some time. So I am still very involved in academic endeavors, doing a lot of research and articles and so on. I attended Johns Hopkins dermatology department to teach residents there, which I did for 35 years, and was honored for that. And I was assistant professor. And I had a very long interest in skin cancer screening, particularly taking measures that would save lives, and we've been very successful in that endeavor.
So the topic at hand is skin cancer. And before we discuss the screening, tell our viewers briefly, how common is skin cancer in the USA?
It's very common. In fact, it's by far the most common cancer that occurs. And unfortunately, the rates are rising. And that's years ago, we didn't have the benefit of sunscreens and other measures. And many people now who are getting skin cancer went through childhood with no protection, really no knowledge of that would be wise to do so. And now we're seeing the results of that at the present time. So we're seeing increasing numbers of patients who are becoming afflicted with skin cancers. But fortunately, there have been some significant recent advances, which we'll mention this evening.
So tell our viewers, what is the rationale for a skin cancer program for screening?
I think the rationale is based on information that became available 50 years ago, and unfortunately was not really picked up by a lot of people. And that was some studies done on melanoma, which is the most serious of the common skin cancers, demonstrated that if it was detected in its early stages, everyone seemed to survive. And that was, everyone said, that's very interesting, but no one took advantage of it. Years ago, we thought that maybe we could improve the outcome of skin cancers by catching things early. It turns out that the early data showed that skin cancers would go at least 6 months and often a year or two before they had any ability to spread through the body. And so we thought if we could figure out a way to catch skin cancers in their earliest stages, we would be able to save most, if not everyone. And interestingly, which I'll give you a bit more details later on, that's exactly what's happened.
When did you start your screening program?
I think our formal program was I began solo practice in 1992. We had some earlier experience with doing skin cancer screening, and we thought it was more important for patients to come in on a regular basis. So if something happened, we'd have the opportunity to catch it. And the biggest problem seemed to be getting patients coming back in a timely manner. We initially sent out when people had a visit, we'd send out when they were due again, send out a visit, and some people came in and many did not. So we started doing what we call serial recalls. This was about 1992, and patients did come in on a more regular basis. Sometimes people would think, well, I just can't come in now, I'll do it later, and then totally forgot about it. But this way, by sending ongoing recalls and explaining to the patients the importance of timely returns, that this has made a big difference. And even now, when I see patients, I constantly remind them the importance of coming back, because when we do a skin check, we not only want to detect the skin cancer if it's there, but detect in its earliest stage. If you don't mind, I'd like to say a little bit about that. By the time I graduated medical school, if you had asked me, what's the difference between an early cancer and a late cancer? And I would have said, well, basically, there's a lot more cancer later on. It's just spread, and usually it's spread more extensively. But what I became to appreciate is, in fact, perhaps a more significant difference is that the cancer itself has evolved in terms of its properties. And perhaps most important is that, I think this is certainly true in skin, and it's probably true with other cancers, an early cancer cannot kill anyone. That is certainly true in skin cancer. I think it's true with others. In skin cancer, we get to see it if we're looking for it on the surface, and we can see that. So if you catch a cancer early, it's incapable of killing. It's incapable of spreading through the body. We have seen that. So our program was focused not just on catching cancers, but catching them in their earliest stages when they're incapable of killing people.
So let's briefly talk our viewers what is involved with a skin cancer screen visit. They arrive at your office, and then what happens?
Well, of course, I get back to a room, and I will have one of my assistants take a brief history. If it's a new patient who are interested in potential risk factors, certain things which I can go in later if you wish, would render a person at greater risk of getting a skin cancer, not particularly if they've had a lot of sun exposure or family history or a lot of moles, the regular moles. These are, or if they have fair skin, if they have red hair or blonde, these people are more at risk. If they have a history of having skin cancer, certainly those individuals tend to be at greater risk of getting new skin cancers. So we know a lot about that. By the time when I come in and view all this information, I'm very aware of a person's low risk, high risk. And one of the interesting things, I'm just going off on a little tangent now, is that we're now much more educated than we were, say, 50 years ago. The public is much more aware of many things. But the problem is that the messages for patients to be most valuable are not getting to the right people. So who's coming in for skin checks? And the answer is young people who are aware of the various media and do have some risk, but the people at greatest risk, which tends to be older men who had a lot of sun and sunburns earlier in life, don't tend to come in unless they notice something on their skin. And unfortunately, they're not very good observers. So they tend to come in, if they get a cancer, it tends to be much more advanced than needs to be the case. If they were being, some people who have some of the features I indicated earlier on, if they were aware of those things, a bit more aware, and came in for checks and thorough exams, we would pick up cancers even earlier than otherwise. But when a person comes in, and sometimes a person comes in, for example, for poison ivy, which we treat, we see their skin is badly sun damaged, and we indicate the importance of coming in for regular examinations because it's capable of detecting skin cancers in their early stages when virtually everyone can be safe.
At what age do you recommend starting a skin cancer screening program?
the people in greatest needs, I would say, are probably people of 40 years or older. And the older one gets, the higher the risk. So most serious skin cancers occur probably people 60, 70, 80, sometimes 90s. But I would think that if persons have had certain risk factors, they had a lot of sun, they've had sunburns, they can start earlier than that. I don't think children in general need regular skin checks unless they have some features that would make them more vulnerable. For example, there are some genetic conditions that make people very vulnerable. People have regular moles, and we see that in children as well. And if there's family histories of skin cancer, those will be situations where I think children should come in and be checked regularly. But the most common individuals are usually seniors, and often they're totally unaware of their risk or the value of skin cancer screening to produce spectacular results.
So they come in for the checkup to be screened. How long does it take?
I think a standard exam, probably in the range of about 15 minutes. If we see something that looks suspicious, might be a skin cancer, or we're just not sure what it is, and we need to do a biopsy, it will take a little bit longer time. I think, though, that an important point is, even though this doesn't take all that long, it does take some time, longer than ordinary visits. We check thoroughly. We check between the toes. We check through the scalp. So that in general, if there's a cancer there, we'll find it.
Okay. And you remove it right then and there.
We can do it right there unless there's some extraordinary circumstance. Sometimes, for example, a person may be on blood thinners, or there's some other reason, or they're going to be attending some important meeting later that day or something, and maybe there's something's on their face. We'll say, well, you can come back in another few days or so, and we do it. But generally, we do it right then. It doesn't take that long, and we get the reports back fairly quick. So there's no problem whatsoever with any substantial delays or anything like that. I think in some countries you go in and they'll tell you come back in 2 months and we'll do a biopsy then. This is unfortunate delay, but we don't have that problem. We're set up to take care of it right away, and that's important.
Ron, we have 1 minute before the break. There is a sense in the African American community that they are not at risk for skin cancer because they have dark pigmentation. Set the record straight on that, and whether you advocate skin cancer screening for that community.
It is true that if you have a darker complexion, you will be less vulnerable to a similar amount of sun exposure, but not immune, as some people think. And it is true that the rate of skin cancer is many times higher in Caucasians or compared to African Americans and people with darker skin types. On the other hand, they do occur in that, and there are often people we see from other parts of the world come to the United States, and they've had a lot of sun exposure during childhood or other times and are at increased risk. They still are not as high a risk as, say, Caucasians who perhaps had a bit too much sun when they were younger. But I think it is, if a person's had a lot of sun or a lot of sun exposure, they should be checked. And in fact, skin cancers do occur. And tragically, when they do occur in people with darker skin types, unfortunately, the individual is totally shocked by it or unaware of it. And these things often get to very large sizes compared to Caucasians who are much more aware of that risk.
All right, thank you for that advice. We're going to pause briefly for a public service announcement. We'll be right back with Dr. Ronald Shore discussing skin cancer screening.
Where did the time go? Somehow I lost all those years. Where did the time go? I don't know how I got here. Oh, how did I get here?
You've done the hard part. You quit smoking. Now do the easy part and get scanned for lung cancer. If you smoked, you may still be at risk, but early detection could save your life. Talk to your doctor and learn more at savedbythescan.org.
We're back. My guest this evening is Dr. Ronald Shore, a Montgomery County dermatologist, and we're discussing screening for skin cancer. Ron, let's go on to discuss your data based on 30 years of patient screening. What can you report to our viewers this evening?
We have some very interesting information. As I mentioned, I have a great interest in this, in particular in using that information to save lives. We're now in year 32 of our screening program, and what we have found that if a person, two things happen, you can get spectacular results. The two things are a very good examination performed by a knowledgeable examiner. Many skin checks are done by family doctors, but in all honesty, they do not have the experience and training of a dermatologist. If one gets a good exam by a knowledgeable dermatologist, I think it is not unexpected that the results are going to be in the range of 100% survival or very close to that. And in fact, in our own program, we have people who come in. We tell them ideally come in every 6 months, but at least come in once a year, and we send reminders. We keep on preaching to them the importance of doing so. And we have numerous patients, some have been with us over 30 years, who come in, get skin checks. And these are people who have had skin cancers. As we save one, it turns out that one of the highest risk of getting a skin cancer is a person who's had a previous skin cancer. And so we have people coming in who have had 1, 2, 3, 4 previous unrelated melanomas, and we check them out, as we do all our patients, very thoroughly, and because they're very high risk patients, and pick these up. If it's detected early, I think I can. What I'm really sort of excited about, if you catch them early, they're all cured. The cancer is incapable of killing the person. I'm convinced of that. That's certainly true in skin, and I think it's probably true in other types of cancer. And we are writing some articles at this very minute, trying to use some of the information we've learned to apply to other cancers. I think more can be done, incidentally, going off on a bit of a tangent, for early detection of other cancers. And there are many developments going on for blood tests and things like that. And it could be in 10 years, maybe sooner, that it'll be routine. When a person goes to their family doctor for examination, they will have a blood test looking for cancers and done on a regular basis, so the cancers can be picked up in the early stages.
Right. So what can our viewers do to lower their risk of skin cancer at home? Not just go by for a skin screening, but what can they do, for example, if they're out at the beach or other things?
Okay. Sun damage that predisposed to skin cancer is cumulative. So a person would say, well, I've had a lot of sun. But if they sort of protect themselves, if they're going to go to the beach, use stronger sunscreens. I remember earlier on when the sunscreen numbers were getting higher and higher, the sun protection factor. And I remember there was talk about in using, for example, a moisturizer started incorporating sunscreens, and they were 15, and they came up with 30. And there were articles coming out and said, we don't need 30, 15 is adequate. And I said, that just doesn't make sense. You want to protect yourself as much as possible. Now they're up to 100 or more. And recently a paper came out, is 100 any better than a 50? And the conclusion was, yes, it is. And over time, as one gets more and more sun damage, not only does it increase your risk of skin cancer, but other things. Some people are more concerned about wrinkles and things like that would be expected to be greater as well.
So besides using sunscreen, is there anything else that our viewers can do to lower the risk of skin cancer?
Right. Well, I would say let me finish up with sunscreens. It's also important how well it's applied. There was another paper that came out that said in 2023, people are still getting sunburned. It's common for people to get sunburned. You think with all these strong sunscreens, it wouldn't happen. I think there are two problems. People are aware of it, but they just don't put on sunscreens, or they don't put them on thoroughly, and damage is still being done. And people say, "Oh, it's not serious," but they don't realize that it can take its toll down the road. And it's not unusual for a person to get a sunburn and then suffer the consequences sometimes decades later, though it can happen much, much sooner than that. What other things can take? I think normally some people, they go for long walks, they may want to do it maybe early in the day, later in the day, as opposed to noon hour and things like that. But I think the most important thing, and I keep on telling this to my patients, the most important thing is coming in to get a thorough exam in a timely manner, which we would say is ideally 6 months, but at least once a year. Because whatever else you may do, you may get too much sun, you may get burnt and so on. But if it's detected early, people tend to do extremely well.
There has been a lot of concern in the medical community that with climate change, it may have adverse health consequences. What is the sense in the dermatology about any correlation between climate change and skin cancer?
I don't think that's getting really all that much attention. For years, the rates of skin cancer, particularly melanoma, were going higher and higher and higher. And I think this is a reflection of people getting too much sun decades ago. It's now beginning to taper off somewhat, but what's happening is we're now seeing skin cancer from other causes. For example, some new medications for cancers predisposed to squamous cell carcinoma. And there's other things that may, certain exposures may cause problems as well. But I think that overall we're beginning to see a little better survival rates. But what's interesting is that they're saying that, for example, in melanoma, we're finding more melanomas, but there's still high death rates in people and I think it's mainly in older individuals who are not getting skin checks. That's what I think really needs to happen. Older individuals who had sun exposures, sunburns years ago, need to be checked on a more regular basis. I think some of the current public service announcements seriously need to be revised. For example, one says, if you notice something, go to your doctor. Well, it's doubly flawed. And this is what I mean by that. Person notices some growth and it seems abnormal to them. So they go to their family doctor, who doesn't have, like, say, the experience and understanding of a dermatologist, and may refer the patient on, depending what the lesion is. Sometimes things are very obvious or a cancer. Sometimes they're not so clear cut. They refer the person on, or may say, I think it's okay, and it may not be okay. The other problem with saying, if you notice something, go to your doctor, is the fact that depending on the patient to recognize it. We are currently submitting a paper for publication showing the difference when patients notice something and when the doctor does. So in our own skin check program, we've been keeping track of all the melanomas in the past several decades. And what's very interesting is we've noted who found the melanoma. Did the person coming in say, I'm very concerned, Dr. Shore, that this could be a problem? And if it's a melanoma, the person gets credit for finding it. But far, far more often, a person comes in and says, I would like a skin check, or I'm concerned about something else, and totally is unaware of what a melanoma looks like. And sometimes this is not so easy, because there are certain features which people probably recognize. This doesn't look right. But there are other ones that are very subtle that probably slip right by until they develop more serious features, and then they recognize. But by that stage, the chance for cure has diminished. The beauty of early detection is that right now we are saving everyone who has an early skin cancer, including all types as it happens.
Ron, share with our viewers some of the exciting developments with treatment of skin cancer when it's more advanced, especially malignant melanoma.
Okay. There's been some recent advances in that. There's a number of new drugs. Every so often we hear of another drug that is very helpful. You may be aware of, or the public may be aware of, for example, former President Jimmy Carter. It was not unexpected that he developed a cancer. Unfortunately, developed a malignant melanoma. He was, besides being president, for those who don't know his history, he was a peanut farmer in Georgia, in Plains, Georgia. And he likely got a lot of sun exposure when he was younger, when there were no sunscreens in regular use. And tragically developed a melanoma, which had spread extensively by the time I think it was recognized. He got placed on one of these newer drugs and had a dramatic remission, I think, for about 6-7 years. Unfortunately, in the past year, or even less than that, the cancer came back, and he's now in hospice care. So some of these newer developments, maybe 20% of people who would have been thought that they had no chance for survival are going on these drugs, and the improvement rates are probably increasing more and more, and will end up surviving. He almost made it. But I want to go back to screening, because early screening is essentially, in our experience, can save virtually everyone. Not we're saying 20%, we're saying 100% if it's done well. And with experience, we've learned how to do it well. And I think there should, right now, if you go to a conference, a medical conference on melanoma, they're all talking about new drugs, which are wonderful, because there are patients for one reason or another who get to that point and need all the help they can get. But I think for most people, if they were getting regular screening done well, I think that a lot of people would never get to that late stage. And besides saving lives, it's going to save a ton of money, because some of these treatments for advanced treatments for melanoma can, when they find it's even better if you combine 2 drugs. Well, these are not cheap, as you know, and it can cost $300,000 or more for one treatment. And unfortunately, most people will not make it, but fortunately, some who would have died are kept alive.
All right, Ron, we'll need to stop on that point. Thank you so much for an informative interview. My thanks to you, the audience, for joining us this evening. You can reach Dr. Shore on the information at the bottom of his screen. As for our next show, it's going to be Dr. Keisha Davis, Chief Medical Officer of Montgomery County, and we'll be discussing the importance of the flu vaccine, the new COVID-19 booster vaccine, and RSV, respiratory syncytial virus vaccine. It's going to be an important practical show. See you then next time for another edition of Housecall. Good evening.